we're talking blood thinners. What exactly are they and how do they affect our bodies?
Denise Allen, clinical pharmacist with GBMC, is here to break it all down for us.
Good morning.
Good morning. How are you?
Good, thank you. So what happens when you get a blood clot?
Well, when you get a blood clot, you're at risk of having that clot go to your other organs like your heart, your brain, and it cuts off the blood circulation, which could be problematic.
All right, so what are blood thinners and how exactly do they work?
Blood thinners essentially keep your blood flowing. It basically keeps you from forming clots, and it keeps clots that have already formed from getting larger.
So talk to us about the types of blood thinners. How many are there and what are the differences between them?
There are two different types of blood thinners. There are the anticoagulants, which again prevent clots from forming, and once those clots are formed, they keep your clots from getting larger. They're antiplatelets, which essentially keep your blood cells from the fragments from sticking to the blood vessels and also from sticking to each other.
And what are some of the pros and cons of the different types?
Well, the older anticoagulant, such as warfarin, that has multiple drug interactions as well as dietary restrictions. Some of the pros of warfarin are that it's been around for a long time, so there is a generic available, which makes it more cost effective, and also it's easier to reverse in the event of an emergency. The newer agents essentially are more expensive because there aren't any generics available, and they have set dosing.
Okay. So what are some of the reasons that we take blood thinners? How do we know if they're working? How do we monitor that progress?
Essentially, you take blood thinners if you have clots or if you're at a risk of forming a clot, if you have pulmonary embolism or atrial fibrillation, if you have a deep vein thrombosis, and you know that it's working. If you're on warfarin, you're going to be monitored on a regular basis. If you're on the newer agents, they're pretty much designed so that they work effectively as long as you're taking it as prescribed.
So we should obviously then see our doctor if this is something that we think we need.
Definitely, and your doctor would pretty much advise you on which medication would be which would be better for you.
What happens though if you're taking it, everything's going along just fine, and then all of a sudden you miss a dose? What happens then?
It's important that if you realize you missed a dose, take it as soon as you can within that same day.
Wow.
If you miss more than one dose, or if you can't take it that same day, make sure you inform your physician or whomever's monitoring you that you missed a dose immediately.
Also very important.
Yes. Blood thinners are safe as long as you take them as prescribed. They're very important medications, and they really help to prevent serious medical conditions. It's also important that you know your dosage, you know why you're taking it, and how long you're going to be taking it.
All right, so where can people get more information if they think they need blood thinners or about what you do?
Well, I'm located at GBMC in the Anticoagulation Clinic, but you can also check with your physician and ask for information.
All right.
Thank you so much for joining us. Very important
you.
information. You don't always think about it, but certainly need to know. So
All right.
thank
Thanks so
you.
much.
Thank you.